Well, hello, everyone. I'm Dr. Ryan Turner, board certified dermatologist here in New York City, also co-founder of TRNR Skin. I am so excited to be here tonight with Dr. Kristina Collins, extraordinaire. This is also a little bit of a reunion for us because we were residents together. So it's exciting to be catching up with a co-resident as well. So I am going to ask Dr. Collins to introduce herself and tell us about where she is, what her day-to-day is like in practice. And she's going to be telling us about her own skincare line named Foy and how she developed that. So I'll turn that over to you, Kristina.
Thank you so much. Actually, while you were talking, I was reminiscing about one of the last times we saw each other. Your community may not know that you're an excellent dancer as well as doctor.
Same for Kristina.
Yeah, we were searching New York City for the only place open because there was a big blizzard and we were just not going to let it stop our big night,
Oh my God,
our
that
big
was crazy. It was
reunion.
literally a foot of snow, like literally.
But don't worry, we found a place. So that was good. So yes, thank you so much for inviting me to come talk. It's so fun just seeing your face. And I actually love FaceTime and Zooms and all that stuff now because even though we can't see each other every week like co-residents, we get to catch up and it's super fun. But I'm Dr. Kristina Collins. I'm a board certified dermatologist and Mohs micrographic surgeon in Austin, Texas. And I own a practice here called Austin Skin, which I co-own with another one of our co-residents, Dr. Sarah G. And like Ryan said, founded my skincare line, Foy by Dr. Collins, with the idea to basically bring together our dermatology-based skincare actives that we know based on studies that we really need to incorporate to have a really successful skincare regimen, but also bringing in the holistic aspect with powerful holistic actives and ultra clean skincare products that really appeal to those who want to seek out even beyond the standard kind of quote unquote cookie cutter things that we usually look for in our medical skincare company and skincare ingredients. So that's a kind of general idea behind what I'm doing.
Fantastic. And so we have to also ask, where did you come up with the name? I'm so curious.
Yeah, so it actually came to me in a dream.
Oh, wow.
Yeah.
Amazing.
I mean, a long time ago, but thinking about what my subconscious was probably trying to say, I think that it was Fountain of Youth.
Mhm.
And my skincare products are all paired with these mantras and meditations that really encourage people to kind of reclaim those minutes that they spend doing their skincare routine, because those are really great self care minutes that unfortunately people spend sometimes thinking about negative things about themselves, or there's like this negative narrative happening in the brain that maybe is stressful. And what I really wanted to do was say, okay, we all know that it's really powerful to meditate or do positive intention setting in the morning, right when you wake up, and at night, right before you go to bed.
Mhm.
Well, most people don't have time to actually just start incorporating this meditation routine. I know for myself as a mom, a working mom, it's like I've constantly got somebody like asking me to do something, whether it's here or at home. And so I saw the skincare regimen that we do, these self care minutes, as this really potentially powerful time that people can use in another way. So all their products come with these mantras and meditations. And with the name, I think with the Fountain of Youth, what we're really saying is the Fountain of Youth comes from within. It's that spirit inside yourself that comes out. And so bringing the beauty, the youthfulness, the power of enjoying your life and that glow from within is really what it's all about. So it's a
I
fountain of
love
youth,
that.
but maybe
I
not in the
love
way you
that because
possibly heard it.
I love that. I think it's just like so important just to find those few minutes to spend time with yourself and that little bit of silence, and then just pair that with your skincare. And
Yes.
we'll talk about that a little bit later too, because like
Yeah.
in your product line, You have a number of active ingredients that also are adaptogens that kind of help with the body's stress
Right.
response.
Yeah.
And so that'll be something we'll get into like as well. That's
Awesome.
excellent. And so, how did you go about sort of the process? Like, what was important for you to be like your first product? So, like when I was developing, I just decided I'm just going to keep it simple into a 1, 2, 3 step system with Turner Skin and cleanse, treat, and moisturize. Tell me, how did you pick the products and what was the formulation process like?
Yeah, it's actually interesting because my first product was not a product that you would classically think of a dermatologist formulating, and that's one of my vulva products. So
Wow.
I always say I have products from your face to your V, and and maybe sometime
Love
I'll
it.
go to the toes. I don't know. We'll see
Yeah,
if I get down the rest of the body. But but
totally.
what I saw when I was walking around, Sephora, and I'm looking around at products and they had things marketed to your, from your eyebrows to your elbows, your cuticles, your everything about your face. I mean, your feet, your hands, really all over the body. But what I saw really lacking at that time, especially, was nothing really directed towards skincare of the vulva. And of course, as a dermatologist, we know that the skin of the vulva is some of the most complex on the body, if not the most complex, because there's all of these hormone changes and microbiome changes, inflammation potentially from, heat, hair removal, friction, all that stuff. And so you have this really specialized region of skin, which of course, as a dermatologist, has tons of potential issues. People
Mhm.
have skin issues down there. And what I saw was, wow, there's actually no preventative regimen whatsoever out there for the vulva. And so
Mhm.
really that was my first kind of go-to was I want to produce something that basically is a daily use
Okay.
formulation to hit all the major aspects of health of that part of the skin. So we want something that's naturally kind of pro-estrogen without putting a lot of hormone, stuff in there that people don't want that's less natural. We want something that supports the microbiome because of course that's super important. We want something anti-inflammatory, something that helps prevent things like razor bumps, razor burn, folliculitis, all those kind of potential skin issues. And of course, something hydrating because hydration of the vulva is one of the biggest problems that people may have in terms of a lack of hydration that could
Mhm.
lead to kind of tearing or, itchiness, like discomfort. So, what can we do that's a product you can use every day that basically makes the vulva healthier and more comfortable? So that's really where I started formulating. And then along the journey, kind of said, you know what? I think it's more than just the vulva skincare that I want to do. It's really
Mhm.
this whole mission to incorporate more natural, more holistic skincare into something that can actually work.
Mhm.
Because, and I think you feel the same way because I know I find it so interesting that our skincare products and our skincare lines really went down this same direction because
Very much so.
coming from the ultra more conservative Harvard background that we came from,
Mhm.
um you don't hear a lot about holistic stuff. And so I love that like this is the direction you went to. And I
Yeah.
feel like there's just really is this, I know I can sense from my patients, and I'm sure you felt the same way, and this maybe is why you went down this line, that
Mhm.
there's just this really big desire to kind of have the best of both worlds. And why can't they?
Mhm.
I know growing up with a chiropractor and acupuncturist as a dad, really
Mhm.
natural holistic background. They had to give me like a million vaccines when I got to medical school because I hadn't gotten my vaccines. I ended up getting more MMRs than like anyone ever, so I could convert in my 20s.
Like,
But I'm like, Dad, way to go. Thanks for thanks for not getting my vaccines. Now I'm gonna have 1 million times the cumulative dose. But you have to get him to work in the hospital. So
yeah.
anyway, I really kind of had this background of like really wanting the clean, ultra clean skincare for myself, for my patients. Sometimes when you look at the ingredient list of things that we use all the time, it's scary. And I think there is an emerging body of evidence that not only are these things actually toxic, they can be absorbed through the skin into the bloodstream. I know chemical sunscreens are a good example where we actually can detect those chemicals in the bloodstream on testing. Now, it's questionable what does that mean? What does it matter? And truly, I don't know if any of us had the answer to that question. But I think there is enough of a reason there to think, okay, the stuff we are putting on our skin definitely can affect our internal body in some capacity. So what are those things, and what things should we exclude? And I think when I looked around at ultra clean lines, my big gripe was, okay, well, this is ultra clean. It's like this little oil blend, but there's nothing in there that's been proven to be clinically effective.
Mhm.
And I think, for you, probably the same thing, wanting that efficacy there is, you're going to recommend something as a dermatologist that if it's got your recommendation, you want to know it's going to be effective. It's going to work for the things that people want to use it for. But still just taking that care to really prevent continuing to like overuse potentially toxic ingredients.
Yeah, absolutely. When I was formulating TRNR Skin, those philosophies came from years of experience with patients.
Hmm.
We don't know what some of these molecules are necessarily doing. You brought up a great point with like sunscreens. How are they affecting some of the chemical sunscreens, bleaching of our coral reefs? Is
Right.
this a real thing? How much testing more needs to be done to understand it?
Mhm.
I thought that there was a lot of value in going to Western medicine, just as you did. You've incorporated Western medicine and
Mhm.
Ayurvedic medicine in your line, just like me, going to the research, going to the data that we do have, and
Yeah.
hand selecting these active ingredients to make a product that's meaningful as
Hmm.
best we can and get
Absolutely.
results. So when you were formulating and thinking about, I'm going to have a vulva product first, was that going to be your treatment oil or what is now puissance? Which I
That
love that
one.
name, by the way.
Yeah. Thank
If
you.
my French is okay, that means power in French. Is that why
That's
you said
right. That's right.
that?
You know me. I'm always trying to get a little joke in there. So
Totally. I
I'm like,
love
oh,
it.
puissance, it does mean power. So that
Yeah.
makes sense.
It's a fabulous name.
Thank you.
Yes, can you take us through puissance, like for
Yeah.
example, and hit on those key ingredients? The microbiome is super hip and popular now,
Mhm.
so tell us about the microbiome, anything that we
Absolutely.
understand or don't understand about it. And
Yeah.
then how does that relate to women's health?
Oh
Yes.
yeah, absolutely. So with Puissance and with the vulva treatment oil, they're similar products in a way. The vulva treatment oil is really great with sensitive skin, people that have potentially could have irritation with a variety of ingredients because it is that oil-based product and it doesn't have anything at all in there that's potentially irritating at all. So it's a product I really feel comfortable recommending to any woman, not dependent on whether or not they have ever had skin irritation or anything like that.
Mhm.
Um, they both have sort of these pro-estrogen botanicals like wild yam, things
Okay.
that we know naturally boost the estrogen levels. Because I know it's interesting, a lot of women are really unaware, I think, of the hormonal changes that happen in this area of their skin throughout their life, but also not just in the perimenopause, menopause sense, but also in terms of like if they start oral contraceptives or change contraception type, if they have new sexual partners and that changes the microbiome in some way and that offsets and changes some things down the line. Even during the menstrual cycle, women have this like dip in estrogen of the skin cells in the vulva, right before and kind of during menstruation. And that's a time when women typically will report that they're kind of like potentially a little funky down there in that during that time. And it's all related to these hormone levels and the way that that causes shift in the pH and the microbiome and everything's all related. So we have these kind of natural boosters, holistic actives that kind of help pump up that estrogen level in a natural way. A lot of women, potentially could use some topical estrogen, but it feels very clinical. Sometimes it feels unnatural. A lot of people don't like the formulations of that. So this is a way to kind of boost without resorting to kind of this more medicinal product that's a prescription in the office. In terms of
Not
the
to cut you off
microbiome,
there. Oh, and not to cut you off there
Oh
before
yeah,
you get into the microbiome, but I think that's important in my patients who, for example, have a history of breast cancer. They want to stay
exactly.
away from estrogens.
Hmm.
So we try to think about what are some bioidenticals or biomimetics that
They
may
aren't going to
have some
increase that
data.
systemic estrogen level. That's really
Exactly.
important, and people are, rightfully, I think, nervous to use hormones in those cases. So this kind of gives you that option to really directly at the skin cell level to boost the hormones that we want, but without causing kind of this systemic response of hormones. And
Fantastic.
with the microbiome, we're using a lot of pre and postbiotics to basically beef up all of the good bacteria. So we are covered with like a rainforest worth of species of bacteria, viruses, fungi, like everything out there, these tiny little microscopic organisms. And it's interesting because just in the last couple years, I feel like there's just been this huge boom of research and information and interest in the microbiome. And I think a lot of ways that started with kind of the gut health stuff, with everybody talking about the microbiome. And then we've learned so much about the feedback that happens between the microbiome of the gut and the brain, and how a lot of mental health issues even can be traced back to the microbiome. And then, of course, now more and more emerging about the skin microbiome and how essential it is in protecting us from all kinds of skin diseases, and potentially even skin neoplasms, cancers, things like that. So I find it fascinating because I think with our traditional medicine, we have really just dropped napalms on the microbiome in so many ways. We're constantly giving out antibiotics and, using those, and especially in dermatology with acne and stuff like that. And it's like, okay, yeah, you can offset the bad bacteria that way, but you're also really stripping the body of the good microorganisms too. So
Mhm.
finding ways to boost those microorganisms by doing things like giving them their food that they like to eat in the product in little ways, or actually giving some of the snippets that they leave behind during their cycles of living. So giving those snippets so those reactions and chemical kind of synapses are still happening in the body, even without them in the vital numbers that they need to be. And I think, honestly, I think that's got to be one of the hottest, most important topics that will be like our next phase of medical care, would be thinking about the microbiome. And, even in terms of our food sources, the antibiotics that are in foods, all of the pesticides that we end up consuming in different ways, all that stuff essentially is stripping the microbiome.
Mhm.
So I don't know.
I
I don't have a
think
good answer for that, but I can help boost it in your skincare
you
products.
can do it in the skincare. Yeah, like same. I got like a real interest like in the microbiome. My partner happens to be a gastroenterologist and studies
Yeah.
the microbiome. So that was also important for me when I was
Yeah.
formulating TRNR Skin in our prebiotic lipid nourishing moisturizer.
Yes.
I focus also kind of on a wild yam, yakan root, found in
Oh,
South
cool.
America,
Yeah.
and also boosted it with something called inulin, so very powerful prebiotic, also something that's found in chicory root. So I
Right.
100% agree. This is going to be the next level skincare,
Oh,
and I
yeah.
wanted to be sure to include it. And you were obviously very smartly included it in your skincare, like as well, to
Yeah.
help first with women's health, and then of course that correlates to the remainder of the skin as well.
Exactly. So yeah, we brought through some of those same concepts. Using things like ferments, for example, which are a great way to kind of boost the microbiome, into some of the other products as well. And then, same with some of the anti-inflammatory stuff that I first kind of got into with the vulva care products, realizing, we have inflammation in other areas. So when I branched out to the facial products, incorporating the ginger root and some of the different elements that we used in the vulva care products there as well.
Yes. And your formulas are really packed with
Yeah.
active ingredients. So you
Yeah.
got it all in there. I mean, they're
Yeah.
really fantastic. In fact, they're so packed, there's no room for water.
Right. Yes,
So
that
tell us
is
why you thought about doing your formulas without water, because it's so
yes.
unique. Yeah, so tell us
Yeah.
about that.
Well,
Yeah.
I part of it is because this desire to really create the cleanest product that I can.
Mhm.
Because of course, when we add the water, we unfortunately have to add other things to stabilize the product. So those would be our components so that they don't grow bacteria, microorganisms. We've
Love it
got to
is.
put preservatives in there. Another thing that a lot of times you have to put in there would be something to make the product look white and look bright. I always tell my patients, nothing in nature except like a cloud is bright, white, perfect, pristine. So all of these skincare products that, people are opening that are just like the perfect, a lot of times something has to be added to make it look that way. So I want to just take a step back and say, how can I make products where I'm not adding anything but actives
Mhm.
and, they just look the way that they look. So like my antioxidant serum is this kind of like orange color. It doesn't impart into the skin, but it's because of astaxanthin, which is an ingredient that I know you and I both love.
Yes.
But just thinking about taking a step back, I don't want to add anything non-essential. So everything in my products are active ingredients. There's no filler, there's no fluff, there's nothing to make it look like it's supposed to look. It just is what it is. And for me, I loved doing that. The other thing that I love about it, just selfishly, is I have dry skin. I've like always had dry skin, and
Mhm.
oil-based, really concentrated product just works really, really well for me. So I think there's always a little bit of you in everything that you do.
Yeah, absolutely. It's got to be
Yeah.
dry down there in Texas.
But it's interesting because like with the water thing, I mean, the beauty industry is a massive consumer of water. So
Mm.
just thinking globally, thinking in terms of conservation, um, it's really not sustainable the amount of tons of water that are used in skincare every year and then just shipped around, and most of the weight's water. I mean, if people would be, I think, shocked to learn that like the majority of their skincare products are water. And
Mm.
they really don't have to be, but it does take a little bit of a jump, I feel like, to get people into trying and using these oil-based products because the texture may be different than what they've had in the past. And I do think, fundamentally, it's such a great step for the environment when it is appropriate for that person's skin type to use these products. I think
Mhm.
it's really, really nice.
And to your point with sustainability and trying to get like a premium product, are most of yours, because I struggled with this, but we did it, using cold pressed oils, or how did you go about that, thinking about further like sustainability when you were formulating?
Oh yeah. And a lot of this really, gosh, so fortunate to find a great chemist to work with because
Mhm.
um I mean, as you know, just there
Key.
are so many decisions that affect another decision in that process of formulation. And just thinking through keeping everything to have that environmental sustainability that we want.
Mhm.
There's so many levels to kind of think through. For me, it was a lot about not choosing things that were from some like remote area that were impossible to source, just to like, I think some skincare products really abuse that in terms of they find some ingredient that is really hard to source and somewhat scarce and then make it like, okay, well, it's so special. So now this costs $400 for your moisturizer. And
Right.
really, it's just creating this kind of like environmentally unstable situation. And the product itself or that ingredient itself is not necessarily that much more powerful. It's just scarce. So
Mhm.
really keeping an eye out for sustainability of individual ingredients was really important to me.
Mhm.
Um, and then, of course, just things that could be sourced in a way that was really reliable and wasn't, trudging through the Amazon
Right.
to find,
I get you.
maintaining the cruelty-free
Yes.
stuff. That was really important to me. So then you have to kind of go that step of making sure that like the individual ingredients are also obtained in a cruelty-free way. And I really relied a lot on my chemist in this regard. I mean, he it's like the bank of knowledge that he has in his mind is really just off the charts. But, throughout that whole process, just we have our list of objectives, in terms of environmental sustainability, cruelty free, these ingredients that we want. And then, okay, where can we source these things in a way that's going to be consistent with our overall ethics?
Excellent. Did you extend that to your packaging like as well in terms
Oh,
of
yeah,
yeah.
absolutely. And that was, it's hard to make those decisions because, as you know, these are expensive decisions. I mean, there's a reason why everybody like packs the shelves with the same stuff that may not be environmentally friendly
Yeah.
because you have to really put your neck out there, and there's a cost premium associated with making environmental choices, at least right now. I
Very
know
unfair
our
that to protect
packaging,
the environment.
yeah,
Yeah.
exactly. It's our packaging is glass and wood, and so we
Mhm.
really wanted to get away from plastics. And then our box packaging on the outside, the is basically this recyclable paper that's printed in an environmentally sustainable way. So there's like different types of printing presses. These are all things that like I learned throughout the process. And I know my first iteration was supposed to have, glittery packaging and stuff. And you
Oh
know
yeah, let's
me.
see the packaging. So
Yeah,
cool. I love it.
you know me. I am just a sucker for some glitter, but what I found out was when you put that shimmer on, it actually renders things unrecyclable, which I
Ah.
didn't know. And then I was just shocked to see, big skincare brands that are clean or environmentally sustainable, seeing that stuff on the packaging and knowing that it's not recyclable in that way.
Wow.
So just deciding not to do that, but it still ended up super cute.
It's very
And
cute.
actually, a Brooklyn-based muralist, street artist, drew the mantras and the birds for me. Jason
Oh wow.
Naylor, he's so
Okay.
cool. Everybody should check him out sometime. He has like really big murals in New York. But yeah, when we first were going to launch, I ended up delaying my launch by 6 months because so COVID, of course, happened, and then there were all the supply chain issues, which I'm sure you ran
Oh
into
yeah.
with your timing as well. Or you're like, the timing of when to decide to do this is so funny. I mean, just things you can never predict. And it was just the wood sourcing was a major problem. And the question was,
Wow.
do you want to move to plastic? And I was just
Mhm.
like, no, I really don't. And I'm just going to wait because that's a core part of our sort of mission is to reduce the plastics.
Mhm.
And I don't have time in this process to find like a super great source of like recovered ocean plastic or something. So I'm just going to wait it out on these wood lids. And it delayed our launch by like 6 months. So I can
Wow.
really see how it could be easy to fall into bad, choices in terms of environmental sustainability because it would just be easier, it'd be easier, faster, cheaper, all the things. But at the end of the day, I think, when you've got a core mission, you've got core ethics of your company, you've got that central mission that you're trying to accomplish, which is to do something good and that bad, you know, every decision after that just has to follow into place.
Yeah, and you did it because you're a very fair price for premium products that are cold pressed and expensive
Yeah,
packaging because like we were saying before, it's so unfair to be good to the environment. You
right.
really have to pay for it. It should be the opposite. I
Yeah,
toyed with it as well. I played with glass. We ended up going with a sugarcane derived plastic. So
that's
at least
awesome.
the pulp that was left over from sugarcane was being
So cool.
reused and repurposed and put under a chemical reaction to create the plastic. And of course, we can replant sugarcane. So for our brand ethos, we very much thought about it like as
That's
well. It
amazing.
does add a little bit to the consumer's cost, but
Mhm.
it is beyond worth it. I
Yes.
feel like we're all in it together to take care of our world and then
Yeah.
pass it on to the next.
Yeah. I love
And then
it.
in also keeping with that, you have a great cause also affiliated with your product.
Yeah. Yeah. I mean, a big part of what I really hope to do was to use this platform to help other women and girls. And I think my central personal mission is about empowering other people. So, what I found is, I mean, I love helping people in the office. I think that's why both you and I became doctors and wanted to, help people every day face to face. I always say I'm really needy of like positive affirmations. That's why I'm a doctor, because there's no other job where every day people are like, thank you. But what I found was that there was this need inside of me that really wanted to help people on a bigger scale. And a lot of that's about empowerment. I think right now, especially, you just, you feel it like we need more people to care about other people's empowerment globally, also here. And so, some money out of every $2 out of every FOI purchase goes to charities. And it's the ones that I have for this past year are the Girls Empowerment Network, which is a really cool organization that started here in Austin. And they basically do tons of programs and education for young girls, basically helping them build confidence. And then the other charity that we donate to is called Safe Alliance. It also started here locally, and they help victims of sexual violence, domestic violence, trafficking, and basically help with both prevention and actually response, when things happen. So both of those things, just for me, were such great, great organizations that support women's power in different ways.
Wow, that's so fantastic. Well, your community there in Austin is so lucky to have you.
Thank
And,
you.
and I'm lucky to have you there because we get a lot of New Yorkers that make their way to Austin, and I get to
Yes.
refer to you. So
It's
I want
always,
to thank
that is
you.
so fun if I see like your name on a chart. It just feels like another little layer, like,
Yes, exactly. And you're the best and such a hard worker. You were mentioning before we started that you're sitting in your lab, you're jumping on here right after finishing a day of skin cancers.
Yes, yes. Yep. I finished a graft and then I jumped in here. So that's why we've got my beautiful lab in the background. I was going to set up in a prettier place, but you guys
No,
got the
not at
real deal.
all. You're so hardworking. Is there anything else that we should know about your skincare line? Any of the other products that we should highlight, particular
Yeah,
ingredients?
sure. I mean, my baby, I would say, of my facial products, my very favorite is the antioxidant serum.
That
And
is,
with that one, yeah, I love that product. It's probably my favorite skincare product of all time. I'm biased because I made it, but Um anyways, with that, I really wanted to create something that was stable, because what I found just doing research was a lot of our antioxidant types of products, which of course centers around like vitamin C serums and things like that, they're really important because I think they help with DNA stabilization, helping our skin deal with all of the kind of pollutants, toxins, UV exposure, all the things we encounter on a daily basis, as well as free radicals from just aging in and of itself. But a lot of the products that we use are very unstable. So especially vitamin C is known to be really bad, really naughty about oxidizing as soon as it kind of gets exposed to air. And then it may not be in a form that's really usable by the skin or effective as an antioxidant. So my first thought was to create an antioxidant serum that I knew was super stable. And in that regard, the oil soluble products really lend a hand in creating that, because oil soluble antioxidant products are more stable typically. So we use a form of vitamin C that lasts longer, that works, essentially longer, so that as you use that product, it's not like you're going to use the product a couple weeks and then it's going to be meh, there might not really be any vitamin C in there anymore. So I love it because it's got the stable form of vitamin C, and it's got some of these free radical neutralizers, like I had mentioned astaxanthin, which I know you like that
tell
product,
us
that
about that.
ingredient.
Yes.
Yeah, and other free radical neutralizers like lipochromin, things that basically help stabilize that DNA, because really that's we all have the genes that we have, but our skin cells and all of our parts of our body are continually replicating, and the things that we do affect the health of the cells of our body. So it's not like I think a lot of people get confused. They think about our DNA code, like our chromosomes, and they think nothing can be affected anymore because we just like have what we have. But
Mhm.
actually, there's this huge interplay between our bodies and the environment. So we can actually change a lot of things about our individual cells and their life cycles by the things that we use or do.
Yeah, I think it's so important. We are in contact with UV, and we as dermatologists are always talking about sun care, but there's so many other things like in the environment to
Mhm.
protect ourselves against. Living here in New York City, we have all this what we call particulate matter for our
Yeah.
audience, which are these tiny little particles that float around in the air that can cause inflammation in our
Mhm.
skin, which leads to damage and premature aging. So I think having things in our chemical formula, in our, I'm sorry, in our skincare formulations
Mm.
is very, very important. I decided to include things like adaptogens, which are also
Yeah.
powerful antioxidants. You have them as well in your
Mhm. Oh
products.
yeah.
Those help give us some more protection against the stressors that are
Yeah.
around us.
I
Yeah.
love it. Yeah. It was one challenge for me finding the ingredients I wanted in oil-based format because a lot of times that was really challenging to find. I again love my chemist that I worked with that helped me kind of figure this stuff out and source it. For example, hyaluronic acid is a humectant and it attracts water. It um, is typically not seen in oil-based products, but they were able to find the hyaluronic acid in the format of these spheres where it can be emulsed in the oil, and then actually as you topically put it on really dives deep and functions as hyaluronic acid. So my
Wow.
eye and lip moisturizer and my day moisturizing balm both have this really unique cool form of hyaluronic acid that I had not seen in oil-based products before. And then my
Wow.
night treatment
Fantastic.
oil has a retinoid. So, a lot of times if you look at oil-based products, you're never going to see a retinoid in there.
Mhm.
Really unusual, but were able to find this great oil soluble gram active retinoid that is really effective, but also gentle on the skin. So not causing a lot of the peeling and flaking and stuff like that.
Very cool. I formulated with something that has retinol-like properties called bakuchiol that I
Oh
got from
yeah.
Vedic medicine. So that was fun. I do have water bases in my product, but I thought that that was like a great product to be able that is to put into skincare that's plant-based, that has
Mhm.
some starting evidence that it can build collagen. And a lot of patients, as you know, get irritated by certain types
Mhm.
of retinoids, and
Yep.
you putting it in something that's oil soluble is going to help out with that irritation, like
Yeah.
as well. So
Yeah.
very smartly
Yeah,
done.
I love bakuchiol too. And
Mhm.
maybe helpful for hyperpigmentation also.
Ah, good point.
Yeah.
Yeah, that is also another plus.
Yeah.
I like as well. So great. We did get a few questions from
Ooh, fun.
followers on
That's
Instagram.
cool.
Shall we go for a couple?
Sure.
All right, awesome. One of the first ones we have here, just kind of segueing by the hyperpigmentation that you were just speaking about. One of the followers asked, "What are the best ways to get rid of hyperpigmentation from dermatitis slash sunscreen?"
Mm. Oh, so the dermatitis and the sunscreen caused hyperpigmentation. Is
It
that what
looks
happened?
like the person's intent was is they may have some type of dermatitis that causes inflammation that leads to
Got it.
hyperpigmentation, and then they may have gotten some irritation
Irritation.
from sunscreen that caused hyperpigmentation.
Well,
So
for
what
one
is your approach to hyperpigmentation?
Yeah, for one thing, if people are super sensitive with sunscreens or just not sure they want to use topical sunscreens on their skin, I always recommend sun protective clothing, hat, sun protective clothing, UV clothing, as something that's really safe, but that, isn't necessarily something you have to remember or do. Especially for kids, I find that's really helpful. because my kids are just like, no, you're not doing it. So I gotta put the hat on them.
Trust me, I just had to wrangle my nephews who are 4 and 7 on vacation.
Yeah,
Meltdown.
it's really hard. Yeah, the hat is where to go, like the UV shirt. And then they actually make supplements that have a fern extract in them. And so like HelioCare is a brand, but there's other brands. And that fern extract is also in some topical products. And it can basically help kind of that UV damage, preventing UV damage from the sun, because a lot of hyperpigmentation is going to get worse with any UV exposure. So
Mhm.
finding a way, even if the person is getting irritated from sunscreen, to prevent UV exposure on that hyperpigmented area is going to be really important for its resolution. And then I would say, you know, for over-the-counter type stuff for hyperpigmentation, I think bakuchiol is one that's helpful. I know that's present in your stuff as well as in Melatonin, which is actually geared towards hyperpigmentation. Um, Retinoids, increasing that cell turnover rate is going to be really helpful as well. Sounds like the person may have some sensitive skin issues, so they would have to see if that was really appropriate for them. I know other things like kojic acid, niacinamide, those can be helpful for hyperpigmentation. Vitamin C, anything that's kind of antioxidant. And then azelaic acid is one that I think a lot of people don't think about very often, but I love that ingredient. It's good for hormonal acne. It's good for hyperpigmentation. It's good for a lot of things and doesn't really cause a lot of like breakouts or irritation. And then of course, you know, you could go with like alpha hydroxy acids, like glycolic acid, malic acid, mandelic acid, those sorts of things that again increase cell turnover and help
Mhm.
do a chemical exfoliation would generally be helpful for hyperpigmentation.
Yeah, absolutely. I echo all of those. I would say to this question, a lot of times chemical sunscreens can be a little bit more irritating because they're meant to break down. So sensitive skin types, rosacea skin types, I would advocate using a mineral-based sun blocker and switch to that. Zinc
Mhm.
oxide being the one with the most evidence and approved for that. I also like tranexamic acid as a good replacement for
Mhm.
hydroquinone. So I'm starting
Yeah.
to use a lot of that for hyperpigmentation. Also like it for redness too. So if people are
Yeah.
kind of like two-toned with the redness, but they have the hyperpigmentation as well. And then I echo all of your recommendations. So thank you for that.
No problem.
And
And I'll say, I think a lot of people think that titanium dioxide and mineral sunscreens are going to make them like really white, but they're
mm,
so good now. I feel like it's almost hard to tell the difference between the chemical ones and the mineral ones. I use like exclusively mineral ones, and I never feel that I'm like painted white.
yes, there's so many great formulations now. On the darkest or more melanated skin, there's probably still going to be a teeny bit of like a
Mhm.
white cast that won't go all the way away, but they're so elegant. They don't feel
Yeah.
heavy like any longer. So I agree with you on that.
Do you remember the like 80s when they had just like the strips of color? Like people would just put sunscreen right here, and right here.
No, it was just crazy. I feel like I remember that from like I'm going to be dating myself from like Weekend at Bernie's or something like
Right, right,
that.
exactly. Like just a strip or like copper tone sunscreen used to have that little girl with like the dog pulling the swimsuit
Totally.
down. It was like a big tan line.
Hugging. Yeah, 100%. We have come so far.
Yeah, we have.
We have another viewer. It looks like she's going through a lot now, some health chemo. So she's undergoing chemotherapy. Chemo has aged me over the 6 months. Is it reversible? Help. So
Yeah.
maybe what do you think about in terms of supportive skincare for your
Mhm.
patients who are going through challenging chemotherapy and it's hard to see these changes on
Yeah,
this?
absolutely. I mean, you know, chemotherapy, we need it for all of these different cancers, but I mean, it's tough to be on a chemotherapy regimen. And the places it hits the most are, of course, you know, cancers are in essence rapidly dividing cells. And so chemotherapy is going to not just unfortunately hit the cancerous cells, it also hits any other rapidly dividing cells in the body. So that's why people have all the GI problems, because of course the skin of the GI tract is an area where the cells are rapidly dividing. And then you've got the hair, the skin. These are the places where chemotherapy affects us the most. I think to answer her question, yes, it's not like she can get better. It's gonna take time. I think chemotherapy could really dehydrate the skin. So I think hydration of the skin would be one of the most important things during that like supportive time.
Mhm.
Reducing inflammation, reducing anything that could irritate the skin further, because we know from our time, God bless us, doing call MGH and pre-med. Oh my
MGH, way to
gosh,
go, Dana-Farber.
really intense medical
Yeah.
regimens. You've got chemotherapy, you've got potentially all these antibiotics, antivirals, antifungal, all this stuff happening to you all at once. The possibility of having different rashes and skin irritations goes up, 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 up. So I would say something very supportive, a lot of hyaluronic acid based products with really good hydration, and then barrier products that kind of mimic that outer skin so that we can replenish some of the things that are being lost. So looking for like Dr. Turner's, your products with the lipid replacement there, thinking about things that really can coat as a barrier, and protect our skin while it's most vulnerable.
Mhm.
When you have chemotherapy, your immune system's also very low. And so things that typically wouldn't have even caused any sort of infection or problem can all of a sudden be an issue when you're on some of these really intense medication regimens. So just really thinking about hydration first and then protection, I think is the way I would think about a skincare regimen.
Yeah, absolutely. I echo all of those. I think also about antioxidants being something that can also contribute, like as well as you were talking about before, that that chemo goes in there, it's breaking up DNA, it's
Mhm.
causing all of these things, free radicals, etc. So
Yeah.
our antioxidants, I also encourage patients to apply topically to help support the skin, help to support the skin barrier, which is just as you say, can lead to infection as the
Mm.
skin starts to get broken down. So we
Yeah,
would,
my day moisturizer in my Foy lineup and the eye and lip balm, they're these really cool, thick, sort of balm-like materials, and you kind of emulsify them and then put them on. And I find that when people are having dry skin condition of any type, even like on their cuticles or their hands, their elbows, anywhere, these
Mhm.
types of balm products can really help just soothe it, protect it and keep it safe.
Yeah.
Mhm.
And let's do one more. Let's see what we got here. This person asked, I thought this was like a little bit interesting, and I'd not thought about it a ton, I have to say. But why don't eye creams have sunscreen in them? I don't think that's completely true. There are some eye creams with sunscreen. How can I protect my eyes? So why
Yeah.
don't eye creams have sunscreen in them? How can I protect my eyes?
You know what? That's a really interesting question. I feel like I've never thought about that before. I think, it's interesting because I think as dermatologists, though, we tend to really prefer people to use their skincare moisturizing products as separate from their sunscreen.
Mhm,
So
mhm,
we like for that sunscreen to be its own standalone product. I think sometimes when people say, "Oh, well, my makeup has SPF 15 and I have this day moisturizer with SPF 15 in it or whatever, SPF 30 in it," they think they're getting more sun protection than they really are. So
mhm.
I would actually encourage people to not mix and match so much, trying to cram in sunscreen into their skincare products, to actually focus on just quality skincare products they use twice a day and in some sort of regimen. And then that sunscreen is that separate product that you're going to put on last.
Well said. I have seen eye creams that contain SPF. I don't feel that they're in great abundance, which is
Yeah.
probably why the person who asked this question is inquiring. If I had to think about it, to answer their question, chemical sunscreens wouldn't be great to have in like
Mm,
eye creams that dedicated that close to the
yeah.
eye. Most eye creams are meant for under eyes, but if we put it on the lids, it can run down. To your point, do something that's a dedicated eye cream, do your skincare. You don't want to put your SPF on before you go
Yeah.
to bed. So
And I do
we'll
think that
separate that.
sunglasses are a really good option for protecting the eye area. I mean, I
Mhm.
know that it probably drives ophthalmologists crazy because we're all like protecting our skin, and then you never see little kids out there with sunglasses on. But what I've really read is that they actually are, our eyeballs themselves are getting UV damage. And so I was just really fascinated when I read about this the other day, because they're like, we're slathering sunscreen on all these kids and nobody puts sunglasses on them.
Oh yeah,
And it's like,
100%.
that's the next that's the
That could
next thing we're gonna have to do.
that could be the next thing for
Yeah,
sure.
I do think sunglasses are great to protect that eye area. We all know that eye area shows our age first. First,
Mhm.
second, and third. It's like the under eye area is just everybody's like, everybody's thing.
Abs-
But
Absolutely.
the skin is so thin and it's so susceptible to those environmental damages. But I
Mhm.
just love having that separate eye care product. It's really directed towards, the needs of the skin, and like to your point, isn't unsafe to put that close to your eye.
Exactly. And I would encourage people, I often do, to think about like a mineral blocker, a zinc
Mhm.
oxide, like around the eyes.
Yeah,
Use a product that is like a sunscreen stick, so it
yeah,
kind of stays in place, doesn't run into the eyes. I do think if somebody wants to do skincare plus sun care in one, that these products that are eye creams or eye serums that have SPF certainly can have their utility.
right.
Um,
Especially on the go. I think,
yeah,
when people are like touching up on the go, just bringing something that's really portable, that's like a stick, like you're talking about, sunscreen brush, one of the sunscreen compacts, all those
mhm.
things are super easy and
Yeah,
really nice to be able to touch up if you are, let's say, out in a patio, having
yeah,
fun, not in your Moe's lab.
exactly. You
I don't need
got
a lot
it.
of sunscreen in my daily life right now.
Yeah. Awesome. Is there anything else that you want to tell us about you, about the line? I feel like I could talk to
Oh my
you all
gosh, I could
night
talk to
on
you
this stuff.
forever. Yeah,
Yeah.
we should try it. We should make it like a regular, we should have like a cocktail hour Instagram live monthly.
I love
Yeah,
that.
let's do
Done.
it. Yeah.
Done.
We can just solve all the world's problems, and then
Yeah. And have fun while doing it.
yeah.
So we owe each other a dance, maybe at the next meeting. I don't know if
Yes,
it's ASDS or AAD,
we owe
but
each
we'll
other a
definitely have
dance.
to catch up
Absolutely.
live. If I'm
Yep,
in Austin, I'm going to find you. If you're in New York, be sure to find
I
me.
absolutely will. Thank you so much. It's been fun catching up with you.
Yeah, it's
I
been
can't wait
so
to see
fun.
everything you do with Turner Dermatology and your new skincare line. I'm so impressed. It
Well, I
looks
so
great.
appreciate you. I can appreciate everything that you put into your line, your formulations, your thought, your care about your community, about sustainability for the
Yeah.
world. So thanks again for joining me,
Thank
and
you.
let's do it again.
Yeah, let's do it.
All right. Take care. Be
You
well.
too. Bye bye.
Bye-bye.